Evet, herkese merhaba. Ben de bugün son olarak anksiyete bozukluklarındaki otonomik disregülasyondan bahsedeceğim. Anksiyete bozuklukları çocuk...
I'll be talking about autonomic dysregulation in anxiety disorders. Anxiety disorders are like reactions against threats or fears. It is a part of fright, flee or freeze reactions in order to survive. There are some bodily changes after the anxiety. It is either to fight or flee. So the basic purpose of the acts in the anxiety is to defend the person. Amygdala is the fear area, and the signals are sent from amygdala and from locus coeruleus. Neuroadrenaline is secreted more and more. It increases that synthesis, and from the adrenal medulla, adrenaline is synthesized again. It affects the blood circulation, and on the muscles there are some increases of the activations, and signals sent from amygdala to hypothalamus warns thalamus, and it increases the synthesis of the cortex. Generally, sympathetic nerve system increases the energy of the body and it prepares body for an action, and parasympathetic system calms the body down, makes it relaxed. In our body, sympathetic and parasympathetic system is at balance, and it is called as automatic accord. And the autonomous nervous system, it was already mentioned, affective disability, affection disorders, and some other disorders are affected by this dysregulation. In the anxiety disorders, there is increase at the parasympathetic nerve system. Majority of the studies are related to parasympathetic nerve system. Central nerve system is related to the etiology of the anxiety disorder, and it was thought that it was also efficient in the PTSD. So at this study with the PTSD patients, when the antagonists against PTSD were given, symptoms decreased a bit, but there was no total healing. Lactate became accumulated in these patients. In the normal population, when lactate was given, anxiety-like symptoms happened. So we can understand that not only central nervous system but also parasympathetic nerve system play big roles on the anxiety. Panic disorder patients was given euhibin, which was alpha blocker inhibitor, and it increased the lactate, it increased the anxiety. So you can understand sympathetic nerve system's role at the anxiety disorders. It is very big, as you can appreciate. What kind of tests can be done in order to highlight these disorders? Cortisol, amyloid accumulation, papillography. They can be measured, they can be taken as certain predictors, but majority of the trials were applied at cardiovascular systems because those trials, those methodologies were less invasive, and cardiac tests are also less invasive. That's why they are in good correlation. Heart rate variability, heartbeat, and blood pressure are among the most calculated factors. Bradycardia can be increased, and tachycardia can also occur because of that dysregulation. And the normal resting time, parasympathetic activity is triggered, but when there comes a threat or a fear, so sudden parasympathetic nervous system regression takes place, and it increases the palpation of the, it increases the beat of the heart. Parasympathetic nervous system is inhibited by sympathetic nerve system, and then autonomic nerve system increases the heartbeat more and more. In 2014, this study was carried out. Social anxiety disorder diagnosed children and non-diagnosed children, a healthier group, was compared, and there was no difference among these children. Yes, autonomic dysregulation and heartbeats, of course, these are important, but chronic dysregulation and its effect on the heartbeat was to be evaluated. Based on the study, we can understand this. Heart rate variability, my friends have already mentioned, it is very important. In the trials, heart rate variability was used, but in time, fluctuations of the heart rate was used. Resting heart rate variability and deep breath heart rate variability is evaluated. Response of the heart is evaluated. When you look at the results, on the normal, healthy individuals, the result is higher, and it is an indicator of healthy autonomic regulation. Both for psychiatric disorders, it plays a big risk factor role. The decrease of that result increases cardiovascular diseases as well. This shows anxiety disorder and its relation to cardiovascular diseases. So heart rate variability changes related to anxiety. The less the HVR is, the less the CVD is. 24 short ECG polarimetry methodologies can be used in order to measure heart rate variability. In 2016, study was carried out for anxiety disorder and normal individuals. Values, they were compared. HRV decreased on the normal healthy group, but in the generalized anxiety disorder and social anxiety disorder, that decrease is lower. And the ECG measurements, highest and the lowest QTC intervals is called as QT dispersion, and that dispersion is related to HVR, and QT value is higher with the anxiety diagnosed people. There are variabilities on the QTC intervals, RR intervals, when the patient is on the supine position. On the dorsals of two hands, electrolytes are placed and measurements are taken. RR intervals changes variabilities. Longest distance and the shortest distance between R and R is checked, and based on the calculation, parasympathetic nerve system functions can be evaluated. Respiratory sinus arrhythmia is used in order to measure the severity of the functions. When this arrhythmia severity increases, the regulation of the parasympathetic nerve system increases as well. I mentioned amygdala. Amygdala sends some signals to thalamus, so when it is facing with a threat, that signals increase the heat beating and also the pace of the respiration, and it increases the chance of asthma or some respiratory diseases. Some painful warnings are given from feet of the patients. Those pulses are used when they are not felt by the patient. It is interpreted as a symptom for anxiety disorder if the patients do not feel those warnings or stimuli. Tear tests, sweat tests, and some motor tests are showing sympathetic nerve system dysregulation. Sweat test is important when there are certain specifications of this test. Patient's body temperature is increased up to 38 degrees for 40-45 minutes. The temperature is kept stable and then the patient's reactions are evaluated. Pupil functions are also evaluated. Sympathetic innervation, when it is robust, pupils are enlarged, and if it is not the case, they do not enlarge. Hyperlipidemia, hypertension, obesity, MI, and cardiovascular diseases are frequently seen on the OSS dysfunction, but there is more need to make more evaluations in our country as well. Thank you. This is all I would like to mention. Thank you very much.